Lourdes Acosta Alba, and the House of Reps Committee on Women and Gender Equality for inviting Oxfam to share our support and insights on House Bills 9645 and 9059. Magandang umaga po sa ating lahat. In May 2020, Oxfam Philippines, together with 26 organizations, conducted the COVID-19 Rapid Gender Assessment among 950 respondents from urban, poor, and rural communities in the Philippines across 6 administrative regions. Our research shows that the gender impact of the COVID-19 validates the issues and challenges presented in the House bills. Specifically, the results in our analysis further show the risks and gender-differentiated impacts of the pandemic, with emphasis placed on the compounded impacts of the pandemic on the most affected individuals and communities in relation to gender roles and responsibilities, gender-based violence, sexual and reproductive health and rights, and social inclusion. In terms of access to social reproductive health services and supplies, the data demonstrated the challenge of accessing SRH services and how it yielded a disproportional effects among vulnerable individuals, including people with diverse SOGI and groups. Gender-based violence was the most frequently reported and perceived fear during the pandemic period, including expressed concerns over the lack of adequate reporting and support systems. There were also expressed fears of the emergence of other forms of gender-based violence like online sexual abuse and exploitation of children due to the youth's excessive use of the internet and social media. Implementing partners of Oxfam's Creating Spaces project from Lanao del Sur and Maguindanao have reported an increase in child early and forced marriage in evacuation centers during government-imposed lockdowns amid ongoing armed conflicts. On unpaid care work, parents, particularly those who are solo and young parents, as well as families living in poverty, are among those who spent more time each day on unpaid care and domestic work, both before and during the pandemic. This has real consequences to their health, economic security, well-being. On social inclusion, the inherent resilience among the vulnerable population played an essential role in managing the negative impacts of COVID-19 on their psychosocial and physical health, economic, and educational well-being. These are few of the data that we have included in our position paper on HB 9645 and 9059 that we have, or rather will submit today. As our closing, to respond and prevent the gender impact of COVID-19 crisis, the following actions be undertaken and included in the provisions of House Bills 9059 to build inclusive societies and economies founded on ethics and principles of care, gender, and social justice. Develop COVID-19 public emergencies and disaster protocols and key interventions based on evidence, sex disaggregated data, and gender-related information and knowledge. Set up measures to ensure the accountability of decision makers and service providers or responders in relation to the policies, decisions they make, their use of public resources, and adequacy and quality of services they provide in the context of COVID-19 response. Ensure the continued and unhampered delivery and provision of SRH services, and it should be made integral and essential to the government's COVID-19 emergency and disaster responses. Strengthen gender-based violence referral pathways, including hotlines, social protection and community care services, enable timely reporting of and respond to gender-based violence, and availability of services and facilities. Given the vulnerabilities and exposure of children, women, and youth to mobile technologies, collaborative assessment studies can be conducted on the gender effects of the pandemic to confront demands and respond to the potential surge of this GBV. Ensure that the psychosocial support is provided to all affected individuals, including women, who represent 70% of the health and social workforce, and solo young mothers who are disproportionately impacted by COVID-19. The bill should also consider the compounded threat of armed conflict and prolonged displacement in armed conflict-affected areas vis the COVID pandemic and in the COVID-19 response management interventions, especially for internally displaced persons and those mostly affected by armed conflict. The bills to be truly inclusive and gender responsive should not only focus on women's gender needs, but consider the gender needs of girls, persons with sexual orientation, diverse sexual orientation, gender identity and expression, persons with disabilities, internally displaced persons, and all marginalized and disadvantaged sectors. We have to ensure that the provisions of the bills promote local leadership, make women and girls and those mostly affected by the COVID-19 crisis at the front and center of response actions. Intervention should also target the existing barriers that prevent women and girls from taking up leadership roles, such as their disproportionate burden of care and domestic work, exclusion from decision-making spaces, threat and violence from family or peers for behavior perceived to go against societal expectations. In view of the foregoing, Oxfam confirms its supports to House Bills 9645 and 9059 and urges its enactment this Congress. Thank you very much, and we look forward to being part of the succeeding processes and consultations. Maraming salamat po again. Thank you.
Thank you, as always, Oxfam Philippines. Thank you, Ms. Janet, for your valuable inputs and recommendations. And yes, we shall see you more in the our next meetings. And thank you for
Thank you
your
po, ma'am.
Thank you.
Thank you
And
po.
for your position paper, that you will be submitting it right soon.
Yes po. Yes po.
Thank
Thank you,
you.
ma'am.
Thank
Po.
you. And let us now proceed